It's great to have you back at Find Future Health, your go-to spot for all things health and wellness. Today, we're diving into a crucial topic that often flies under the radar: how certain vegetables can impact our kidney health. We all understand the importance of vegetables in maintaining a balanced diet, but did you know that some may not be the best choice for your kidneys? Stick around because, right after the countdown, we'll be sharing some vital tips on how to manage your diet for optimal kidney health. Plus, we'll suggest alternative vegetable choices that are gentler on those essential organs. Your well-being matters, so let's navigate the world of kidney health together and make informed choices for a healthier you. Number 1. Spinach. Spinach is a powerhouse of nutrition, especially for individuals dealing with kidney disease, notably those undergoing hemodialysis. Maintaining the right balance of potassium is crucial, and spinach, particularly when cooked, demands caution. The cooking process condenses the vegetable, effectively increasing its potassium concentration. To put it simply, a cup of cooked spinach has more potassium than the raw version. This isn't just a minor detail. Excess potassium can lead to hyperkalemia, a condition where potassium levels in the bloodstream become perilously high, posing serious risks, especially to heart function. Additionally, spinach contains oxalates, which deserve attention due to their tendency to team up with calcium and form calcium oxalate stones, the main component of most kidney stones. This combination occurs when oxalates, organic compounds found in various foods and produced by the human body, bind with urinary calcium. This binding reduces calcium's solubility, fostering the crystallization process that leads to stone formation. The absorption and metabolism of oxalates vary among individuals, making dietary recommendations more complex. Research from Kidney International has shed light on the increased risk for certain individuals, particularly those with a genetic predisposition to kidney stone formation or a history of kidney stones. These individuals exhibit higher intestinal absorption of dietary oxalates, amplifying their risk, especially when consuming high oxalate foods like spinach. While spinach can be a nutritious part of a balanced diet, individuals with a history of kidney stones or kidney issues may consider moderating their intake or exploring alternative greens with lower oxalate levels. It's all about making informed choices for your kidney health. Number 2. Rhubarb. Rhubarb, famous for its tangy flavor and fibrous stalks, adds a unique perspective to the kidney health discussion. While it can bring a delightful twist to dishes such as pies and compotes, its chemical composition warrants careful consideration, especially for those with kidney concerns. What sets rhubarb apart is its high oxalic acid content, a key player in the formation of the most common kidney stones, calcium oxalate stones. Among vegetables, rhubarb has one of the highest oxalate levels. When oxalates are ingested, they can bind with calcium in the digestive tract, creating calcium oxalate, which is then expelled through urine. For those with healthy kidneys, this isn't typically problematic. However, for individuals with kidney disease or a predisposition to stone formation, the increased oxalate levels significantly elevate the risk of developing stones. According to a study in the Clinical Journal of the American Society of Nephrology, individuals with a history of oxalate stones, particularly calcium oxalate stones, are advised to limit their consumption of high oxalate foods like rhubarb. Additionally, rhubarb contains anthraquinones, known for their natural laxative effect. While promoting regular bowel movements is generally beneficial for overall health, excessive intake of anthraquinones may lead to diarrhea, potentially causing dehydration. Dehydration, in turn, can exacerbate kidney issues by concentrating urine and potentially facilitating the formation of kidney stones. If you have concerns about your kidneys, it's a good idea to moderate your rhubarb intake and consider exploring alternative options to safeguard your kidney health. Number 3. Swiss chard. Swiss chard, with its vibrant leaves and rich nutritional profile, poses a bit of a dilemma for kidney health due to its significant components: potassium and oxalates. Potassium, an essential mineral crucial for cellular functions, is abundant in Swiss chard. While beneficial for many, the regulation of this mineral becomes compromised in renal pathologies. In conditions like chronic kidney disease, CKD, the kidneys struggle to maintain potassium balance, potentially leading to hyperkalemia, a serious electrolyte imbalance with cardiac implications. Research highlighted in the American Journal of Kidney Diseases emphasizes the need for meticulous potassium management in renal diets to avoid such adverse outcomes. On the other hand, Swiss chard harbors oxalates in significant amounts, organic compounds known to crystallize into kidney stones. These compounds have an affinity for binding with calcium, forming calcium oxalate, the core component of most kidney stones. The Journal of the American Society of Nephrology points out that dietary oxalates are a modifiable risk factor for those prone to stone formation. This suggests that individuals with a history of oxalate-related stones may need to moderate their intake of Swiss chard. The way Swiss chard is prepared can also influence its impact on renal health. Boiling may reduce oxalate levels, since these compounds are water-soluble and can leach into the cooking water. However, the potassium content may become more concentrated if the chard is not boiled or if the cooking water is retained. This nuanced aspect of food preparation highlights the importance of culinary techniques in dietary modification for kidney health. To distill the health benefits of Swiss chard, its inclusion in a renal diet must be carefully calibrated. While it remains a nutritional powerhouse, its consumption should be tailored to the individual's renal profile, striking a balance between the need for essential nutrients and the risk of worsening kidney conditions. Number 4. Potatoes. Especially their skins, potatoes, a dietary staple for many, raise a specific concern for individuals with kidney-related health issues, primarily due to their substantial potassium content, which is especially concentrated in their skins. The outer layer of potatoes is not only rich in fiber, but also acts as a reservoir for various minerals, including potassium. The concentration of potassium in potato skins is notably higher than in the flesh alone. This becomes a critical consideration for those with compromised renal function, as the kidneys play a crucial role in maintaining electrolyte balance, including the regulation of potassium levels. When renal function is impaired, as seen in conditions like chronic kidney disease, CKD, or in patients requiring dialysis, the risk of hyperkalemia increases. Hyperkalemia can disrupt normal heart rhythms and is associated with significant cardiovascular risks. The link between potassium intake and renal health is emphasized by studies reported in the Clinical Journal of the American Society of Nephrology, indicating that managing potassium intake is vital to avoid the cardiac complications of hyperkalemia in patients with advanced renal disease. Furthermore, the way potatoes are prepared matters significantly. Improper preparation can contribute to an increased potassium intake. For example, boiling potatoes may lead to a leaching of potassium, reducing its content. On the other hand, frying or consuming potatoes with their skins on retains the majority of potassium. This preparation factor is pivotal in dietary planning for individuals with kidney concerns, where the method of cooking potatoes can make a significant difference in the dietary potassium load. Number 5. Tomatoes. Ever thought about tomatoes being more than just a tasty addition to your meals? Despite their vibrant hue and culinary versatility, tomatoes can pose a nutritional challenge, especially for those keeping an eye on their kidney health. Let's delve into this surprising aspect of nutrition. Tomatoes are packed with potassium, a crucial mineral that plays a role in maintaining fluid balance, nerve signaling, and muscle contraction. However, for individuals with kidney issues, especially in conditions like chronic kidney disease, CKD, managing potassium intake becomes a delicate task. When kidneys struggle, they may not effectively filter and remove excess potassium, leading to a condition known as hyperkalemia. This imbalance in potassium levels can have serious cardiovascular consequences, as highlighted in research published in the Journal of Renal Nutrition. Interestingly, tomatoes themselves don't carry a significant amount of oxalates, which are commonly associated with kidney stone formation in other foods like spinach or rhubarb. Instead, the primary concern for kidney health revolves around the high potassium levels in tomatoes, particularly when consumed in concentrated forms like sauces and purees, which pack a higher potassium density than fresh tomatoes. For those with kidney concerns, dietary guidance often suggests limiting tomato intake to avoid worsening hyperkalemia and associated health risks. It's crucial for individuals with kidney issues to consult healthcare professionals to tailor their dietary patterns appropriately, ensuring that their meals support kidney health while still savoring the flavors they love. Now, let's explore a fascinating aspect related to kidney health and favorite foods like spinach, potatoes, Swiss chard, rhubarb, and tomatoes. There's a lesser-known secret in nutrition science that might pique your curiosity. It's not just about eating less of these oxalate-rich vegetables, it's about the company they keep on your plate. Enter dairy products like yogurt or milk, which can be real game-changers. These dairy delights have a unique interaction with oxalates, binding with them in a way that prevents their accumulation as kidney stones. So, if you're someone who enjoys these veggies but worries about kidney stones, adding a bit of dairy to your meals could be a smart move. Remember, everyone's nutritional needs are unique, making it crucial to consult with healthcare professionals or nutritionists.